Month. Our PCH Hangouts will feature inspiring women sharing learnings on their journey as well as health tips as follows. Wednesday, 18th October, topic, Healthy Living, with 2 special talks on cerebral palsy awareness with Professor Akyaa-Yao and breast cancer awareness with Dr. Ladzekpo. Wednesday, 25th September, topic, Learnings on My Journey, speaker, Mrs. Comfort Okran. The time is 6:30 p.m. to 8:30 p.m. every Wednesday at ICGC, the New Wine Temple, East Legon. Also be our guest every Sunday at 8:30 a.m. to 10:30 a.m. Let's worship, fellowship, dance, pray, and receive God's inspiring word with host Pastor Albert Okran. Also note, there will be a women's special service on the 22nd of October 2023. Guest minister
Jesus, walking around these walls, I thought by now they'd fall, but you have never failed me, Lord. Waiting for change to come, knowing the battle's won. Yes, my heart will sing your praise again, for I know that it's true, that your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail. Your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail, never fail. Oh. Walking around these walls, yes, I thought by now they'd fall, but you have never failed me, Lord. Oh, waiting for change to come, knowing the battle's won. My heart will sing your praise again, oh Lord. Your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail. Your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail. Your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail. Oh no, you never fail. Oh, I've seen you move. You move the mountains, and I believe I'll see you do it again. You made a way when there was no way, and I believe I'll see you do it again. I've seen you move. You move the mountains, and I believe I'll see you do it again. You made a way when there was no way, and I believe I'll see you do it again. Yes, I'll see you move. You move the mountains, and I believe I'll see you do it again. You made a way when there was no way, and I believe I'll see you do it again. Lord, I believe. Yes, I believe. Oh, I believe. Yes, I believe. Oh, I believe. Yes, I believe. Oh, I believe. I'll see you do it again. I'll see you do it again. Oh, Lord, I'll see you do it again. 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 I know the victory's won. I'll see you do it again. I'll see you do it again. Yes, I believe your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail. Your promise still stands. Great is your faithfulness, your faithfulness. I'm still in your hands. This is my confidence. You never fail.
The next item is a scripture reading. It's taken from the book of Luke, chapter 1, verses 46 to 50. And Mary said, "My soul magnifies the Lord, and my spirit has rejoiced in God my Savior, for he has regarded the lowly state of his maidservant. For behold, henceforth all generations will call me blessed. For he who is mighty has done great things for me, and holy is his name, and his mercy is on those who fear him from generation to generation. This is the word of the Lord.
There is a sweet and
strength, His grace, our rule, His glory. And it's one of those hymns that I can sing over and over and over and over again. Thank you so much, the choir, for rendering such a wonderful, in fact, creating a wonderful atmosphere for us to have today's session. You are all welcome to today's PCH, that we are looking at the health of our individual bodies as well as that of our community. As you know, this month we dubbed it the Pink and Green Month because we wanted to create awareness about not just breast care, but the fact that we have cerebral palsy that affects members of our community, and let's see how we can love, we can care, and show, to ensure that they all are part and parcel of our space here at the New Wine Temple. So once again, let me welcome every single person to today's program at today's Hangout. It's a practical Christianity Hangout series. And for those of you online, we are so privileged that you are here with us one more Wednesday. I assure you, it's going to be rich and very, very fulfilling. We'll start first quickly with the profile of Dr. Mrs. Caroline Ladzekpo. She's someone, when she talks about breast care, you would understand and know that it's not just for females, it can affect a male as well. So those, our male counterparts who are still at home, let's send them messages and say, come, you are missing a lot. Dr. Ladzekpo is a senior specialist at the Department of Obs and Gynae at the 37 Military Hospital. She's definitely passionate about preventive health care and has special interest in wellness, fertility, and clinical diagnostics. She's a certified member of the West African College of Surgeons. And when you reach there, when you know this person has reached there, that means that the person was being So we have a real or being person with us today. And she... She gives back through her services at the Health Advice Foundation and the Plus Medical Center, where she provides specialist consulting, diagnostic scanning and screening, as well as health seminars to help women make informed and safe choices. Doc Carol, as she is affectionately known by her patients, believes that serving as a medical professional to save another person's life is a great privilege and honor. Doc resides in Accra with her wonderful husband who loves her to bits, supports everything that Doc does, and their children. So please, with a round of applause, let's welcome Dr. Ladzekpo as she speaks to us about breast care in this month.
Thank you. Thank you, Comfort, for the introduction. Congregation of New Wine, thank you for having me. And I really appreciate the fact that Pastor Albert and Comfort asked me to be here, to be part of this program. Thank you. Kindly have your seat, please. We're going to have a very wonderful discussion. I'm sure you can all see me when I stand here. Well, I'll try and come out at some point. Actually, we're here to discuss breast care, and then I added a little bit about breast cancer awareness as well. Because the world over, October has been set for Breast Cancer Awareness Month. And why do we need to discuss this? It's because breast cancer is the commonest female cancer in the world. And it's important that we know about it. As the introduction went, my name is Dr. Carol Ladzekpo, and I am a gynae specialist. I really have passion for preventive medicine. Well, by the time we all leave here, I'm sure if nothing sticks with us, we will go with the word, get involved. The world is asking all of us to get involved in breast care and breast cancer awareness because, as I mentioned, it is the commonest female cancer. And actually, before we go into what it's all about, we need to know about these two beautiful structures that is present in both the male and the female. But with us, the females, it's more pronounced. It makes us who we are. It nourishes the next generation. The breast is also a sexual organ. In fact, the Bible mentioned that it should satisfy our husbands all the days of their lives. And so it's very important. When you look at these structures, it's not just something that is protruding, but then we have features of it that we all need to know about. So the breast extends quite wide from just under the collarbone all the way to about just when the rib cage is about starting. And when you look at the breast, we have the lobules, that is the fat structure. And we have the ducts which produce the milk. We have the nipple and also the skin around it. And these beautiful structures sometimes can be diseased. Although the statistics are quite scary, we still need to know that according to WHO, more than 600,000 were diagnosed in 2020. Unfortunately, about half did not make it. If we come down to Ghana, with the diagnosis, 1 out of 8 women will not make it. And if you take 100,000 women, you have about 76 having breast cancer. So the statistics are quite scary. But the good news is when we detect it early, we can do something about it. And breast cancer is indeed preventable. Well, how will one know that there is breast cancer? The symptoms may always not follow one pattern. You may have to look at a few. And actually, it's not every type of breast cancer that comes with a lump. Some may come presenting just as pain. And for others, there may not be a symptom at all. It may be picked up during screening. In fact, we are pushing the preventive part because when we engage in the screening, which in a few times I will take you through what it's all about. When we engage in the screening through the breast care, which we advise every woman should do, it's important because it brings about early disease that we can do something about. So there are various forms of screening. The first one we push is the self-breast examination. And there will be a slide that will show you what it's all about. With a self-breast examination, we advise that you divide the breast into 4 regions through the nipple. The 5th one is around the nipple area. And we have breast tissue under the arm, the armpit. We have breast tissue there. So as a lady, we want you to stand in front of the mirror. You can stand akimbo, look at your breast, look at the size, look at the shape, look at the skin around it, and then we ask you to go in a circular motion as to how you can go about the breast palpation or feeling the breast, if I should put it simply that way. So when you look at the the quadrants or the 4 parts that we divided it into. As I mentioned, don't forget the nipple area, and then don't forget the area under the armpit as well. Remember, it's important to squeeze the nipple so that if there is any nipple discharge, you will note it. Usually, we advise that this self-breast examination, if you are menstruating, then you should do it like 5 days after your menses, where the breast is not that painful and you can easily go around it. Also, if you are not menstruating, we ask that you do it at least once a month, and you should know yourself. It's not every lump that is breast cancer. Please note, it's not every lump that is breast cancer. There is a way that the one that is cancerous feels. Usually, it is firm or it may be hard, and it feels like palm kernel when you go around, and the surface is quite rough. If you pick a lump, it doesn't mean that you have breast cancer. You need to see your doctor. And when you're doing the self-breast examination, please note that you can do these exams while standing. You can do it whilst you are lying down, or even when you are in the shower, as the next slide will show you. When you are in the shower, when there's soap on you and then it's quite rubbery and you can feel any changes. If you note a lump, as I said, don't be alarmed. Please get in touch with your doctor to help you. As part of the screening methods which we do, as I've mentioned, we have the self-breast examination or the physical examination. If you don't do it yourself, you can go to the clinic, a nurse or a doctor will be able to take you through. And that is why October has been set apart by the world, that please go into any clinic or any health facility and kindly have your breast checked. And many people have come to know that they have breast cancer just by walking into the clinic and taking advantage of Pink October. And if you have had that breast screening done, then you'll be given a ribbon to attach to your dress to show that, yes, you have participated in the breast cancer awareness and you are really getting involved. So as part of the screenings that can be done, we also advise mammogram. The mammogram is a special type of X-ray, and we usually advise if you are above 40 years, you should do your mammogram every year. The mammogram picks very small lumps that you cannot feel yourself, and based on that, there is staging, and the doctor will be able to tell you where, if there is a problem, let me put it that way. Other types of screening that we can do include the ultrasound scan. We usually do that for someone who is not, who is younger than 40 years. But let me take you back to say, we need to know who is at risk of having breast cancer, that the person needs to be aware. Actually, if there's a lady who has a family history of breast cancer, where maybe she has lost a mother, a sister, an auntie, maybe the person had the breast cancer before 40 years, then it means that you are at risk of having breast cancer. If the first menstruation is before 9 years, and if menopause delays beyond 55 years, then you have high estrogen in your system, so then you can have breast cancer. There are some ladies that because of menopause, and the problem it comes with, there's something we call hot flashes, where one time you feel so hot that you want to remove your clothes, and another time you cool down. We sometimes give some medications to try and control this. We put the woman on what we call hormone replacement therapy, and unfortunately, it prones such women to having breast cancer. Also, other stuff like obesity does not only cause lifestyle diseases like hypertension and diabetes, it can also cause breast cancer. People who take alcohol and smoke, those two things, they always cause everything. They are at risk of having breast cancer as well. Also, if there's a lady who has other cancers, it prones the person to having breast cancer. So as part of the screening, we do genetic screening for women who have had, whose relatives or mothers have had breast cancer before the age of 40 years. And it's actually available here in Ghana. You may hear things like breast cancer gene 1, breast cancer gene 2 screening. It's really available. Despite the cost, it is available here in Ghana. It's all part of the screening. So, should we pick any lump in a lady's breast? What do we do? In fact, let me say that such a person needs more than just one doctor to handle her. You need the general doctor who confirm for you what it is. There's a need for a biopsy to be done to really find out whether this is cancer or not. Because as I mentioned, it's not every lump that is cancer. Most of them are not. So should we find that there's an issue, when we take the biopsy, we also will look for certain, let me say, proteins to find out what kind of treatment we will have to give to the person after all. And also, as part of the people you need, or a lady will need to take care of a lump and the situation, you need a psychologist, you need faith-based treatment as well. We are Christians, so you need to get in touch. You need your family. You need a friend that you can be talking to. And when you have to go and see your doctor, it's best you write down the things that you want to go and discuss, because sometimes you arrive and you forget all that you want to say. And you know, for us Ghanaians, our general response to how are you is always, I'm good. There's no problem with me, before we break out and start talking. So kindly write down, ask your doctor, what is this lump about? Why do you think it's cancerous? The doctor will tell you the features. So there are stuff that you need to see for you to be worried enough to want to see your doctor, and some are on the screen. Whilst examining yourself, if you pick up a lump that, as I mentioned, it is rough, the lump is, the sides are not very smooth, you need to see your doctor. Look at the skin around your breast. There's a particular type that when it's getting late in the stages, you get to see that the skin looks like that of an orange peel. We call it pole orange in medical terms. So you look at the skin. If your breast didn't have any dimple on it, and all of a sudden you see a dimple, then you should be worried. If you are having nipple discharge and it is bloody, you should be worried as well. Other changes that may get you, if it's looking reddened, if it is swollen, then you should please see your doctor. Usually cancer is painless, but someone may come just complaining about pain and pain and pain. If you go to one doctor and you are not getting any kind of response, you can please move on for a second opinion, and someone may be able to help you. As I mentioned, when you do your self-breast examination, kindly remember to always feel what we call the axillary tail, or the breast cancer under the armpit. And if there's any issue, you pick it up. For some people, there will be no lump anywhere in the breast, but there will be lumps in the armpit because there are structures there we call lymph nodes that the cancer may spread to. And actually, as part of the treatment, we have something we call staging of the cancer. And once it is picked, we will have to find out where it is. Is it just in the breast? Has it moved to the surrounding tissue? Has it moved into the lymph nodes? Has it spread? For those that come in quite late, for which we don't want, and we are preaching the prevention, most may come with swelling in the armpit, swollen arm, sometimes the breast is ulcerating, or you see real ulcer on it and stuff like that. That's why we are preaching the prevention, because if we detect it early, we can do something about it. There's a type of the breast cancer called ductal carcinoma in situ, which ladies who have it almost everybody gets cured. But then if it is not picked early, then it's an issue. So we ask that please see your doctor early when you detect anything. You may ask, where can I get help from? Usually that's where the issue is. Someone may find out that she has breast cancer, or may have felt a lump but doesn't know where to go to. So a public hospital, a private hospital, faith-based, we have a lot of information on the internet, and you can have NGOs as well help you to know what is happening. Yes, we are all being asked to get involved, and you may ask, what can I do? We will say, spread the word. Please spread the word that breast cancer is preventable. Breast cancer is curable when detected early. We can all fight against breast cancer. It's not only ladies that get breast cancer. Men also, as Comfort mentioned, have a 1% chance of developing breast cancer. So we advise men to also come and get involved in this Pink October Breast Cancer Awareness Month. And I know that on the 29th of October, you all come to CTE as you do end of October Breast Cancer and Breast Care and Breast Cancer Awareness Month. It's a very big health fair. When you close at 10:30 a.m., please come over and we'll be glad to screen you and let you enjoy a very nice church environment. If you don't leave here with anything at all, we say get involved. And I hope this get involved will stick with you very much, like how I sat under the ministry of Mrs. Okran in one of their August series, and I heard synergy, and I haven't forgotten it, synergy. So whoever I meet, I see how I can collaborate with the person, synergy. So please get involved. I'll pause to let you ask questions, but the questions is going to wait. I forgot to mention my boss is here, my senior lady, Prof. Yao, and let me say, I am the John the Baptist, and so we'll wait for Jesus to come. Thank you very much, ladies and gentlemen.
Thank you so much. I mean, that was a quick approach about breast cancer and how it affects us and how we can use the early detection method to ensure that we are able to save ourselves early enough. And interestingly, I'm sure you will also know somebody who has been affected by breast cancer, don't you? So let's clap for Doc for taking her time to show us not just the symptoms, but how we can detect and prevent breast cancer from making a short stay of our lives. Well, as she said, she's not John the Baptist though, but there's always a precursor. And we are really, really privileged to have another dear friend of ours, Dr. Yao, Nana Yao. Nana Echa, Nana, why are you worrying me today? Nana Echa, I never knew the babies also need a cardiologist. So when I heard that we had a pediatric cardiologist, I was like, now heart disease, yes, there's only those whose hearts are tired of beating, they have the issues. But we are privileged in this country to have a seasoned consultant pediatric cardiologist. She is currently at the National Cardiothoracic Center and also at the Department of Child Health in Kolebu. She's also an associate professor at the Department of Child Health at the University of Cape Coast Medical School. Our docs today, they are the top. She is also with the West African College of Physicians. They're not small people, though. The Royal College of Physicians, Ireland, and also the fellow of the pediatric faculty of the Ghana College of Physicians. Brothers and sisters, with a rousing applause, let's welcome Dr. Akyaa-Yao, the one and only. And if you thought today is a season of very giant people in the land.
Thank you very much. Kindly take your seats. Thank you so much. Thank you for that. You've made me all shy and embarrassed now. But thank you very much for the kind introduction. And I'm really, really honored. I'm really blessed to be here, to be in this ministry. It's just such a blessing. And now we're going to shift gears from the ladies and men, and we're going to shift gears to children, which I'm very passionate about, but also affects adults. So I'm not sure, I think you can start my slides, please, if that's okay. So we're going to talk about cerebral palsy, and one would wonder, why cerebral palsy? What does it even mean? What is this strange word that we're talking about? I would like to most definitely acknowledge the Most High God and his expression of ministry through Reverend Albert Okran and Lady Comfort Okran. I'm grateful to the leadership of New Wine Temple for the opportunity to share on this subject. And so just about 12 days ago, on the 6th of October, it was World Cerebral Palsy Day. So just as the month of October is dedicated to women and to breast cancer awareness, the 6th of October is World Cerebral Palsy Day. World Cerebral Palsy Awareness Month is in March. And this year, the theme was Together Stronger. And that's really a powerful theme. When I think about the Tower of Babel, God came down and looked at it and said that these guys, they are together. And whatever they have decided to do, they will do. So coming together really, really means a lot and is very powerful. And the theme this year for World Cerebral Palsy Day was Together Stronger. Really mainly to bring together people living with cerebral palsy, their families, supporters, organizations, and to create advocacy. One of the important things about World Cerebral Palsy Day advocacy is an all-inclusive world without stigmatization for these children and adults who live with cerebral palsy. A lot of the words in medicine come from Latin, and cerebral means brain and palsy means weakness. It is estimated that 1 in 400 children in the UK, where they would have good research and audits, have got cerebral palsy. It translates that 17 million people in the world have got cerebral palsy, and that's quite significant. In Ghana, it is approximately estimated that 1 in 300 children would have cerebral palsy. We all drive around Accra. We see people who come up to our cars, the needy, asking. Some of them are able, some of them are not able. A lot of them would have cerebral palsy, the children and the adults. So what is cerebral palsy? It's a movement and a coordination disorder. It is really a major cause of disability that affects function and development. When you think about movement, movement is quite complex. When you think that, okay, I want to pick a cup from the table, something as simple as that. You think about it, the messages are sent down to the different muscles, bone, ligaments, joints, all the things that would hold, let's say, your hand, your fingers together. Then you reach out your hand, and then you pick it up and do whatever you want to do with it. So movement is actually quite a complex process. Imagine that someone can't even see the cup and yet wants to reach out for the cup. It's still movement. How do they do that? Imagine they can't smell what is in the cup, or say it's something dangerous that is in the cup and they bring it up to their nose. They can't see it. So movement is quite complex, and it involves quite a lot of the aspects of our will, our mental faculties, vision, muscles, ligaments, and all of that. So when it comes to cerebral palsy, we've said that it is a disorder of movement and coordination. And there would be different patterns. So just ignore the fancy words that are there. But spasticity just means stiffness. And it just means that the muscles, the ligaments, all the organization that goes into smooth movement, that doesn't happen. And so the patient would have what we call spastic cerebral palsy. Then there's what we call dyskinesia. And in dyskinesia, the tone, which just means that the way the muscle moves smoothly without stiffness, is increased. There are abnormal movements, and there's abnormal posture. And I'm sure you've all come across these children or adults, some of them in wheelchairs, who may not be able to move smoothly, or they're sitting in a different posture, or they're twisted. Sometimes, doesn't look very, very pleasant. Then there's ataxic cerebral palsy, which affects more of the coordination. And so walking, carrying things, balance, everything is quite a challenge. Now, what are the causes of cerebral palsy? A lot of the times, parents will ask us, what have I done? Why has my child got cerebral palsy? And basically, cerebral palsy can happen anytime from when the baby is inside till more or less about 1 year to 2 years, sometimes even 3 years. So basically, it affects the developing brain. And so anything that can affect the developing brain, we're all born with a brain, but we grow, we mature, the brain is still growing, most of our organs are still growing. When there is an insult to the developing brain, then cerebral palsy can occur. So there have been certain factors that have been identified, like babies that are born quite early, so premature babies. And this would be anything from, say, 24 weeks these days, or 1 kilo. These days, babies are born in the developed world 500 grams, all the way up to 36, 37 completed weeks. And then multiple gestations, triplets, twins, quadruplets, 5, all of those are risk factors. Then when babies don't grow very well inside, we call it growth retardation. The guys seem to be more at a risk than the ladies, so male sex. And then infections that mothers can get when they're pregnant. And then disorders that affect our genes, chromosomes, the building blocks of our bodies. Infection to the brain, meningitis. And then problems during birth, around birth, difficult deliveries. So how does it manifest? It usually manifests as developmental delay. So the parent will come to you, my baby is supposed to be sitting, baby is not sitting. Baby is supposed to be crawling, baby is not crawling. Baby is supposed to be walking, baby is not walking. And that creates concern. Sometimes the parents notice. They'll say that, oh, the head, literally translated, is not standing as it ought to be. Or the baby is just floppy. So there's hypotonia, as we would put it. And then sometimes parents may notice that later on, that the child prefers to use one hand than the other. So when the child is left-handed, it's good. I mean, it doesn't matter if a child is left-handed or right-handed, but if the child is exclusively left-handed and does not use the right hand at all, there can be cause for concern, and that should be investigated. or when the child doesn't crawl in what we call a symmetric fashion. Crawling is symmetric. One hand on the other side, and then the foot, and then the other hand. When that doesn't seem to follow that pattern, it's something to be investigated. So it's very, very concerning and very devastating to wait for 9 months, expectant parents, happy parents, looking forward, and then you have a baby, and then after a few months you realize that things are just not right with this baby. We're waiting for baby to smile, baby's not smiling, baby's not focusing, baby's not sitting, baby is not crawling. Those are very concerning. And it could be either of the extremes. They could be hypertonic, which is increased tone, or hypotonic, which is decreased tone. And all those will have challenges associated with them. So I just wanted to talk to you briefly about some of the cases that we had seen, just to bring it home. So one of the babies that we had was born at birth and didn't do too well. When a baby is born, we assign certain numbers to them based on the way they breathe, the way they appear, the way they behave, and it's called an Apgar score. The top score is 10, and ideally anything above 8 is kind of satisfactory. So this baby was born and had an Apgar score of 7 and 8. We assess at 5 minutes and we assess at 10 minutes of life. So nothing really, 7 and 8 is not too bad. Then the baby was admitted to the special care unit for 2 days for observation and then discharged home. 2 years later, the parents realized that the baby is not walking and has got a mild learning disability in terms of speech. There's weakness in both legs, and the baby had quite a small head. So they went to the doctor, had a detailed examination done, and one of the examinations we do for cerebral palsy would be an MRI of the brain, and it showed a brain abnormality, which was suggestive of cerebral palsy. The second case was a 2-year-old who was taken to the hospital because the child had not walked yet, was bottom shuffling, as we would call it. So not even crawling, just going around on the bum. And then when we went into the history, the baby was preterm at 32 weeks. The membranes broke early enough, so the waters came early. There was a concern whether this baby had what we call congenital infection, was admitted because of breathing problems, had antibiotics and all of that. And at 2 years of age, when the baby is examined, the baby has got increased tone and stiffness in the legs. Again, an MRI that was done showed that the baby had got an abnormal brain suggestive of cerebral palsy. The third case I'll share is one of the cases that really saddens me. So this was a school teacher, a lady, who taught in a school outside of Accra, and I won't mention for the sake of protecting her privacy. And she brought this 1-month-old baby who had breathing problems. So we examined the baby, and the baby had got what we call a duct, and that is a tube, an abnormal tube in the heart, which should have gone away. But the tube was causing unnecessary problems and hadn't gone away yet. Of note, in examining the baby's head was a little bit small, not too small, but the baby also had cataracts. And we call them congenital cataracts. So you see that the eyes, when you look into the eye, it's white. And that was quite concerning. And when babies have got cataracts, there are certain things that we think about. So we went to do further investigations. We test in particular for certain viral infections that can occur during pregnancy. So we tested for toxoplasmosis, all the fancy names, and one in particular called rubella. And when we tested, the mother was positive and the baby was positive, and that was the cause of the duct, the heart problem, as well as the cataracts. The baby struggled, breathing problems, recurrent admissions. We addressed the heart issue. Later on, the cataracts got addressed, but the baby had a learning disability. It took a very long time for the child to walk. The baby didn't grow very well. And one of the reasons why this saddens me is because rubella is a virus that children should get vaccinated against. However, in Ghana, for a very long time, this was not the case. And it's only recently, in the last 5 or 6 years that rubella vaccine has become part of the routine immunization program. And this wonderful, school teacher obviously would have caught it. It just shows up like a cold, a bit of a, nasal discharge. She most likely caught it from one of her students in school. Obviously, she was pregnant at the time, and these were the consequences of it. And because of these type of consequences, and research and audits that has gone into these things is the reason why in developed health systems, every child should get immunized against rubella. And so a little bit of a digression for the young ladies here, childbearing age, ensure that you're either vaccinated against rubella or make sure that your rubella status is checked when you do get pregnant. We did an MRI for this child. Again, it showed an abnormal MRI suggestive of cerebral palsy. How do we diagnose it? Like we said, the initiating event can take place from birth to 3 years of age. Ensure that children, parents with children, when you're concerned, seek appropriate specialist advice. Don't just go to any doctor. Look for a pediatrician who is trained to look at these things and to manage these types of problems. The children usually, like we've talked about, will not achieve their developmental milestones. And cerebral palsy changes over time. The signs and the symptoms can change, although the insult is fairly static. 75% of the patients will have a learning disability. 25% of them may not be able to walk, but they may be able to use assistive devices. 25% will be severely disabled in all 4 limbs. Some of them will have epilepsy, visual problems, dental problems. The one important thing about cerebral palsy is that because it's a movement and a coordination disorder, the cognitive function of the child is not particularly terrible or bad. So a child or an adult with cerebral palsy can still function to a certain extent. They may be able to have a certain degree of independence and manage. They can use, let's say, I'm sure you've all seen people who use electric wheelchairs or different types of devices to walk and write. From a medical standpoint, there is no real cure for cerebral palsy. And the aim is to help people with the condition to be active and to be independent with various types of therapy, physiotherapy, speech therapy, and assistive devices. What can you and I do? What can we do? As we've said, it's a very devastating diagnosis for most parents, and they need support at an emotional level, at a mental level, at a spiritual level, at a physical level, education-wise. We all know that when you have a challenge, when you have something going on with you, it's great to have somebody to support you, somebody to be there who understands, to encourage you, if nothing at all, even just to listen to what you have to say. When we look in the Bible, and we're children of God, we remember Mephibosheth, who was Jonathan's son. And one of the things I believe is that God is in every single situation on earth. And so we allow ourselves to be vessels in the lives of these children and adults. David extended his hand to Mephibosheth, and he came and sat at the king's table, although his dad and his grandfather had passed away. When we look in the New Testament, the blind were brought to Jesus, the lame, the lepers, the deaf. No one was excluded from Jesus' care and his love and attention. And I believe we definitely ought to do the same. And I'm very intrigued by the verse in Luke 14 that says that when you have a feast, when we have a party, invite the poor, the maimed, the lame, the blind, and you will be blessed because they can't pay you back. Children, adults with cerebral palsy will not be able to put money in our pockets, maybe never give us much. But you shall be repaid the resurrection of the word of God. So in conclusion, cerebral palsy is a disorder of movement with various causes. Patients can fall anywhere in the spectrum of having a mild learning disability to a severe learning disability, mild movement disorders to severe movement disorders. Patients and their families can be helped and supported to lead fulfilling lives. And I like the words of Stevie Wonder, which says that just because a man lacks the use of his eyes doesn't mean that he lacks vision. I am different and not less, says Tem.
Hangout will feature inspiring women sharing learnings on their journey as well as health tips as follows. The time is 6:30 p.m. to 8:30 p.m. every Wednesday at ICGC, the New Wine Temple, East Legon. Also be our guest every Sunday at 8:30 a.m. to 10:30 a.m. Let's worship, fellowship, dance, pray, and receive God's inspiring word with host Pastor Albert Ogren. Also note, there will be a women's special service on the 22nd of October 2023. Guest minister, Reverend Selina Klu Abini. We invite everyone, men, women, youth, and children, to join us this October as we aspire to excel and be role models in all aspects of our lives. We are one big family in Christ.
We are indeed one big family in Christ. Thank you, Dr. Carol, and thank you, Naya, for being with us. I'm sure this has been quite enlightening for you. I think one of the things that struck me was the fact that even though I knew of people who had cerebral palsy, I never really knew what caused it or how it's diagnosed. So thank you for today. And Carol, even though I hope I can call you Carol and not the doctor. Okay, thank you very much. Thank you very much. And Carol, I also didn't realize that indeed when we are going about our breast examination, you said often, but I thought it was always once a month, personally. I'm confessing today. Okay. So thank you very much for enlightening us today. And if you do have any questions, even though we talked about breast care as well as cerebral palsy, if there's something that you want to question, I hope we can do some medical questions, yeah. So please approach the mics and let's hear from you. For me, Doc, Carol, if you know someone who is obvious that he or she is suffering from breast cancer, and in this case, this is a personal story. I knew of a lady who was obviously, because the boobs were so swollen, and we invited her to go and do the checkup, supported her. She went for the first one, and then she returned and said she was scared. We were ready. No, she went, and then she came back and said no, she was scared. So she wouldn't attempt the medical hospital again. Unfortunately, she did pass. In this case, how do we, push her into to do the right thing for herself in this case?
Yeah. Thank you. As I mentioned, it's not something that comes naturally to someone to go seek help in this situation. And she needs almost everybody to come along because the shock of first being diagnosed of having the condition is there. Usually the person comes in denial, and so the person needs a psychologist, a counselor in the church, the family, the friend groups that can help her to accept the condition. And actually, because of sometimes the side effects that come with the side effects associated with the treatment, it actually scares some people and they don't want to go through the treatment because the chemotherapy, the radiotherapy, and all the other treatments that come along, usually it's difficult to go through some of them. Someone may go through without feeling anything, but others may come with serious side effects. A lady may not want to lose all her hair. Recently, someone came to me, a lady, and she was beautifully Sakura, as we put it. And I was like, oh, you're looking great. And she walked to me and she told me, I am a survivor of breast cancer. I want to share my story. And so I looked at her, and she's gone through treatment, and she's doing well. The treatment is quite long. Sometimes it goes beyond 5 years, extends to 10 years. And when you come to think of it, sometimes you don't get to finish antibiotics. You are left with few ones, and then it's in the car, you divide it, there's some in your bag, still you won't complete it. So the person actually needed encouragement. And as part of the treatment, we look at the will of the person, the will of the person to want to have the treatment. It's also very important. That's why continuously it's what we call a multidisciplinary approach to the treatment, and everybody should come along and rally along. Even at the later stages, we should still show love.
Even at the latter stages to show love. Yes, please. Could you ask your question? Your name first.
Good evening. My name is Rita. I want to thank you for this opportunity because my sister is a survivor. Within 3 years, I've lost 2 friends to cancer, and it was terrible. And because my sister has been going through for the past 3 years, I've been with her throughout the journey. So I realized that the information about breast cancer is not much out there. One of the friends that died, she died because of this, because when she went to the hospital and was diagnosed, she had a baby. After 7 months, she found out that this is the case. She went to the hospital, she was booked for, she was booked to go through the chemo. When she went for the first time, because of the symptoms, she was like, oh, I can't do it. Then this orthodox medicine, somebody referred her, so she went back out of the hospital to go through the traditional medications. But unfortunately, just after 3 months, she couldn't survive it and she died. The second person went through that. She was even a nurse. Then a doctor suggested another means after she's gone through the surgery by taking off her breast. And the medication that she was given, whether it was overdose or due to whatever reason, we lost her. But my sister for the past 3 years has been going through. She had a surgery by removing her first lump in January. In September, she was diagnosed, and she was almost at the 4th stage. Yes. And it's been very terrible. It's been very horrific because the psychological effect alone. Now, you go to her and whatever she says, you just have to say yes. So I realized that we don't have much information. And I don't know, the way we have the breast cancer, the moment one get that information, I'm going to die. But my landlord's wife in my house has been going through for 26 years. She's so healthy. If she doesn't tell you, you wouldn't even know. She's also a survivor. So I don't know. My question is, after the surgery, what next? After we diagnosing the person that this is your situation, what next? Some people get to the hospital and at the end of the day, the cost involved alone scares them. They go back and they die. So if we can do something about the information that we put out there. Thank you.
Thank you, thank you, thank you so much for sharing such a personal session with us. Rev, did you want to make an intervention? Okay, right. Okay, thank you very much. And that's a very, difficult one. Yes, I've seen it feeling Dagochi, so I can see that it is there. I don't know what supports. You've diagnosed the person. What next? Yes. I think it's to you again.
Yes. Yes. After the diagnosis, what next? It's very important that we all rally around such a person. After going to the hospital, as I mentioned, the doctor that diagnosed you may not be the only one taking care of you. So after we've had surgery for the person. And in fact, most of the treatment come as surgery. As the lady mentioned, either we take off the breast completely or part of it. And then we also remove what we call the lymph nodes that is under the armpit as part of the diagnosis and then the staging. So after the surgery, we'll give the lady a stage of the disease as to where it is. Is it just localized in the breast? Is it to the surrounding tissues? How deep to the surrounding tissue is it? Has it spread all over? And so we also offer the hope that after the surgery, and even if your breast is removed, we can do reconstruction for you. So you look the same way as you used to, and you'll be happy. In fact, the reconstruction can be done as the primary surgery is being done or later. There are types of bra that you'll be asked to buy to fit very well into this condition. But then we need to always remind you, and this is where the psychologists and the faith-based counselors really play a very important role, that you're going for the long haul and you need to be prepared psychologically. You need to have the will to stay alive. And so you come along and know that you're going to take medication for quite a long time, and you're going to do certain tests at some time. Some of the medications will come with some side effects that you may need to be in touch with your doctor, you may need to be in touch with a nurse in order for you to go through the rough edges. Also, remember that it is costly. So over here, we don't have much of the support lies on the family and friends, but out there are foundations and organizations that can help the lady to purchase her medication and go through the treatment. So you look for where you can get funding. Very important, because the radiology, the radiation, oncologists and all that is quite expensive. So yes, the person has been diagnosed, surgery has been done. There are ways in which we need to help the person to go through and through to the end of the treatment. And there are survivors like your sister who can join with others to tell them, yes, you can go through it. I actually had an auntie who was diagnosed before 40 years, and she lived to 93 years. One time I visited her and I asked her, what is she doing to keep alive? She gave me a whole list. Her food, she always goes on a walk every time after eating. She doesn't eat after 7 p.m. And, you know, she was a teacher, quite strict, so I sat down and I listened to everything, and it was good.
I like that. I think we would like to know more of what someone who has actually survived past a certain age, I mean, how that person is able to make it through. So, but I want, somebody is asking the doc, Inanaya, they are asking you a very serious question. They are asking you that, what is the importance of personal choices in safeguarding our health? Importance of personal choices in safeguarding our health.
What is the importance?
Yes.
I think it is extremely important. I think it is, health is almost everything. And one of the verses I like in the Bible is in 1 John, which says that, I wish, beloved, I wish above all things that you may prosper and be in health, even as your soul prospers, that you may prosper and be in health. I mean, it's important to God that we are healthy. And it's important that we make the right choices to be healthy. It's important that we don't assume health. And one of the things about maintaining good health is being proactive about it. and being consistent with the choices that we make. And particularly in this part of the world, when in developed health systems, it's been noted that Africans tend to get diabetes, high blood pressure, and quite early. So they put these people in an at-risk group. But we who are living in this part of the world where the risk is so high, we are we're not very proactive about our health. So I think the simple answer is that it's second to none, but it must be priority. Second to praying and your spiritual life, your health comes next.
Second to praying, your health comes next. But Doc, you mentioned it in passing, but you talked about the support groups. How do we as a church, I don't think we may have a lot of people who may have issues with cancer, but let's say, can a church play a role in setting up a support group, either for even the cancer or the cerebral palsy? How do we create such a group to support people who may have such challenges?
All right. So the church is a social group also, and this is where we find family. And so when you walk in here, you feel very accepted. And so we can start from the counseling unit, where we have people who are interested in not only the emotional or psychological aspect, but also the physical aspect. So apart from doing the emotional counseling, we also look at the physical aspect and organize programs where we can check people's health status, check their blood pressures for free, check their sugars, check their cholesterol, encourage them to have their daily walks and also to keep fit and healthy. All these things help. So then it is holistic. You get the spiritual aspect, you get the emotional, and then you go away with the physical as well.
So in this case, Doc has actually endorsed our Saturday walk. So ladies, we are definitely going for the walk on Saturday. Anybody who excuses herself, we are in trouble. We have to come. And you know that after the walk, we will have the breast screening part of it. So today, thank you for endorsing Saturday's walk. On 21st October, we are walking for our health to ensure that we are able to support each other in this quest. I see you at the mic. You can kindly ask your question. Name and the question, please.
My name is Barbara Tetem. Doc, please, I want to find out from you whether the cancer treatment for breast is on the National Health Scheme, one. Number two, I realized that breast cancer is so aggressive here in Ghana, and I think very pervasive in Africa. I have relations out there, and I have an in-law who has had breast cancer since 2004. She's white, and she's alive. I have family who are white, and they have cancers, breast cancers, and they are still alive. Now, somebody sent a clip not too long ago from Korle Bu. The very ambience in Korle Bu is not so attractive. And per what she said on the WhatsApp platform, the kind of care and support that they gave there, I'm not putting down Korle Bu, but these are some of the things that make people shy away from going for further treatment. So I wonder what can be done about that. Thank you.
Thank you very much. I wish I have the powers to address all the questions you put to me, but I'll try. The National Health Insurance, let me say, part of it takes care of cancer treatment. At least you get to see your doctor and the diagnosis will be made for you. But when it comes to the main treatment, it's so expensive. National Health Insurance will not be able to support you as of now. They said they are trying to. But we have support from churches, from other foundations, other breast foundations that people donate to that may be able to help you. But much lies on the family and also the individual's own financial support, and it actually becomes a challenge. With the situation in our hospitals, especially the public settings, we wish it to change, and we are looking forward to it changing. The sheer numbers when you come in is discouraging, as you said. But there are private and quite secluded clinics where you can have treatment. But invariably, most people will end up at Kolebu. We have other centers around, and you can be directed to any through the foundations when you have an issue. Thank you. I hope I did address your question, Barbara.
Okay, I have, yes, please ask your question.
Thank you. My name is Enyonam. I'm a cerebral palsy advocate. I want to thank Prof for the education. I'm so excited because we don't get to talk about cerebral palsy so much in our churches, because most of the churches see it to be kind of a spiritual thing than a medical condition. So I'm so excited about that. My question is, cerebral palsy, 6 October, breast cancer awareness in October. But we hear so much about breast cancer more than the cerebral palsy. My question is, what are the other health institutions doing in collaboration with CP Ghana for the cerebral palsy awareness to get very far, just like the breast cancer awareness? Thank you.
Thank you very much. So that's a very important question. What are we doing? I think we have to start doing something. Because interesting enough, you mentioned October is Breast Cancer Awareness Month. Cerebral Palsy Awareness Month is March, but then 6th October is the day that it is celebrated. It happens that October is Down Syndrome Awareness Month, and we haven't even heard of that yet. So there is a lot for us to do, I believe, as children of God, to bring awareness of these things. And I was really excited when I saw the topic cerebral palsy, because like you rightly said, we hear a lot about breast cancer, but the other health entities appear to be in the background: cerebral palsy, Down syndrome. So this is where we are going to start from. We need to plan so that next year by this time, cerebral palsy will be all over the media, just like breast cancer is all over at the moment. Thank you.
And let's clap for New Wine Temple for taking the lead.
Absolutely.
Yes, we took the lead there. Absolutely. And I must say that it was Rita who drew my attention to it, and we said, let's see how, the lady said, let's see how we can organize it to make our month not just breast cancer month, but cerebral palsy as well. Great. So thank you. Thank you. So please, we are back to you.
Yes, go for it.
AC says, please, is chemotherapy and radiotherapy the only means of treatment, since a lot of people are scared of its adverse effects?
Yeah, thank you for the question. AC, no. Apart from these two major ones, we have other forms of treatment. As I mentioned, when we take the biopsy, we look at presence of certain hormones on the biopsy. We will look at what we call receptors for estrogen and progesterone, and another protein we call HER2 or HER2. And based on the presence of these receptors and then the HER2, it will tell us what kind of treatment we should give you. There are other forms of treatment like immunotherapy, targeted treatment, and also hormone treatment as part of the general treatment of breast cancer. So there are other forms.
Thank you for letting us know there are other forms, and we could benefit from those other types of treatments. What? Yeah, okay, right. Doc, please add on to it.
Yes, I just wanted to humbly add on. She's a specialist here in breast, but because I get a lot of these questions to do with breast cancer and other disease entities. And most of the time, I think it's because we don't understand a treatment. And so we are more scared of the side effects because we don't realize that the Coartem is going to deal with the malaria. It's not to worry that maybe or maybe not there could be, liver dysfunction. But if you look at the side effects, then the disease could actually destroy you. And I realize that that's what happens to a lot of people. And it's about our mindset and really understanding that radiotherapy, chemotherapy is what has been prescribed by the doctor. That is what they think. If they really think that another form would do the job, they would prescribe that other form. So I think it's, like we rightly said, education, support in helping people realize that, okay, you may become bald, there are other side effects that may happen, but this is what is important, and it's only for a period. Like Dr. Carol said, it may be for 2 years, it may be for 1 year, but at the end of it all, you will say, like most people, I am a survivor. So understanding the treatment is important. That's just what I wanted to add.
Thank you very much. I have two people, so I think I saw you, so kindly ask your question, then we'll go to you.
Please, good evening. My name is Juliet. Please, good evening. My name is Juliet. Please, I want to find out, whilst you are talking, you've been mentioning about premature birth. And I want to find out how does it cause and how are we going to treat it?
Yes. Please, I didn't hear the end of your question. How
does a premature birth, how does it cause and how are we going to treat it?
Okay, all right. Palsy, all right. So how it causes that, the brain is immature. So if you have a baby that is born preterm, let's say at 24 weeks, usually babies should be born at around 37 to 40 weeks. Then when they are a little post-mature, it will go into 42 weeks. So babies that are born very early, everything is immature, everything is very fragile, everything, right from the hair to the soles of the feet, the nails. So the same fragility that you observe outside is the same way the brain is also extremely fragile. Now the brain is very sensitive to oxygen. It needs oxygen. And usually babies that are born small and early, they also have challenges with breathing, with their lungs. Their lungs are not mature. So then even obtaining the oxygen and the oxygen going around their body in simple terms and getting to the brain can be a challenge. So they might go through periods of what we call hypoxia, where there isn't enough oxygen going to the brain and other organs. And that slowly leads to what we call an insult to the brain, and that can lead to cerebral palsy. It's not every child that is born preterm that will have or is at risk of cerebral palsy. Some children. So please don't go away thinking that once a child is premature, it means they will have cerebral palsy. No, that's not what it means. It is a risk factor, not an absolute.
Thank you very much. Yes, please, your question.
Good evening. My name is Sylvia. This has been very insightful and knowledgeable. And to buttress and to add to what Dr. just said, my last born is a preterm and he's very, very fine by God's grace.
Thank God.
He's 8 now, so it's not everyone that has it. Yes, it's true. Now, my question is, I have a friend whose daughter has cerebral palsy, and you can actually see that the development in terms of her brain is not really going too well. Now, she's in school with other kids who are okay, but you can see that she's not actually like making any progress. Now the dad is thinking, what should he do? Does she have to take her to a specialized school? Do we have institutions that actually have that care? And if there is, which one do you recommend? Thank you.
Thank you very much. So one of the things about disabilities that is being advocated in developed health systems is all-inclusive, and particularly all-inclusive education. Because it's been noted that if you put children who have a disability, you put all of them in one class, all they see is disability. So how are they going to learn? However, if you put them in a class with children who are more able than they are, they see that, oh, the other children are doing this, and children learn a lot by observation. So it's not advised these days that children with disabilities are put in special schools. What is suggested is that they are put in the normal stream, but they have support in the classroom for themselves. Sometimes it's challenging because the children may have disruptive behavior, so then they disorganize the whole class. So one of the recommendations again is to have somebody in the class, and if the behavior is very disruptive, allow them to be in class for a few hours and then take them out and do activities with them. A lot of them like to be active, although they may not seem to be active. They like to be out in the open, and that is very good for them. So that would be the suggestion. Our environment is very challenged with special schools, very, very challenged. And so more often than not, you have to speak to the authorities of a school and then put somebody in the classroom for your own child, for your ward. Thank you.
Thank you very much. I believe you would agree with me that this has been a very informative session. Thank you, Carol. Thank you so much, Nanaya, for coming here to the New Wine Temple. By the way, they had promised 100 years ago that they would come. So today we've pulled them here. Thank you for coming. So in concluding this very informative session, could you kindly give us your closing thoughts? Starting with you, Dr. Carol.
Thank you very much, Comfort. I really enjoyed myself being here. As I mentioned, thank you. As I mentioned, October is Breast Care and Breast Cancer Awareness Month. Let's all get involved. Please, ladies, examine your breast at least once a month to know if there is any problem. And if you see any problem, kindly approach a doctor or a nurse. And please know that early detection does save lives. Thank you.
Thank you. Well, my dear sister has spoken for both of us that we are very happy to be here. Absolutely delighted. Indeed, this is family, and I love and feel the family atmosphere. So thank you for having us. Thank you for inviting us. Sometimes when you see the needy who come up to your car and children on the streets, adults in wheelchairs, some of them drooling saliva, some of them abnormal posture, sometimes it can be frightening. Sometimes you don't want to be associated with it. We don't want to be associated with it. But they really need our support. They really, really need our support. And if you know a parent, if you know a family whose child has cerebral palsy, please support them. You may not, it's not about money, it's not about food, but just sit beside them. Let them know that somebody cares about them. Let's not isolate them, because indeed, together, we can make a huge difference in their lives. There's a lady that I spoke to, and she sat in her house weeping for days when she had a child with cerebral palsy. Nobody came up to her. Then slowly, the people in her church out in Tema started coming to visit her, started supporting her. Today, it's a different story. I believe she'll share the testimony one day. So let's support, just like our Lord Jesus said to us. Thank you very much.
I think this deserves a standing ovation. Let's stand to applaud both Dr. Yao and Dr. Ladzekpo for being with us, for making such an amazing day for us. Thank you so much. Thank you for showing how much you love us as well. And with that, I would like to remind every one of us that Saturday we are having a lot of issues. When I say issues, we are having some fun. And then Sunday, we are commemorating it with both our green and our pink. We now understand our green. We understand our pink. So let's rock it on Sunday. It's now time for offering. We'll be grateful if you could kindly come and give your offering as we usually do. The band would minister for us as usual. Thank you very much. We'll be right back. Today is a big day. You know, when we come for PCH, we must have some giveaways. And so I have some exciting giveaways here. You know, is my basket ready, or is my bowl ready? Is it ready? Are we ready in this space? Come on, come on, come on, come on, come on. I want some people who are excited. Today there are not a lot of males, so the females will win all the tickets. So today we are privileged to have 3 things to give away. Number 1 is a book by Albert and I that is on the pitfalls as well as the propellers that help us in our way, and it's called The Snakes and Ladders. It's based on observing that game that we like so much. Maybe Saturday some of us will play it, but there are lessons there. Are you curious? You would enjoy this book. I can assure you personally. I mean, I'm speaking from personal experience. As if that is not enough. Should I show you what else is in the basket? I will show you. I also have airtime. I have airtime. And here you are. I think, Do you want it? In fact, let me go and sit down because the way you're not excited, no, I'm going to sit down. No, I shouldn't sit down. Then give me morale. Give me morale. Morale. Yes. And then we have there's a program by EWN, Executive Women's Network. It's going to be on the 3rd of November. So if a male wins Lucy quiz program for Saturday, you win a ticket. However, if a female wins, it's an Executive Women's Networks program. Which one do you want? Are you a male or a female? Who is winning? I should start some more. Eh? Right. One person, really lucky person has come up. Hey. Okay, somebody who has a Gmail account. You beg, eh? Somebody like I say heart attack. Okay, so somebody's telephone number ends in 444. Some people are now trying to remember their phone numbers. Right. Okay, so Dora Soji, you won. Yes. Congratulations. Auntie Carol, please can I come and supervise? You can't even believe it. You won a prize that has our book, Snakes and Ladders, 100 cities airtime, and a ticket to the Executive Women's Network. Right. So there's another. Can somebody? So today we have 2 winners. So our next same prize. So male, female. Should we give the chance to the males? No. You. Oh. We are getting boycotts from here. Some people are saying that next time they won't come. Please come for us. Come. Oh, another female has won. And this particular female, when you see her in the welcome party, the way she smiles and sometimes she hugs you, you will feel like coming. If I'm not even going home, you stay here forever. Now let's welcome Sandy Poppy. Dog. Thank you so much. We'd like to thank the Executive Women's Network for this opportunity. We'd also thank Reverend Albert and his wife. So, as we get ready to close, shall we welcome our head pastor to come and close us? Thank you very much, Reverend.
Thank you very much. A big thank you to you, Carol, for making time to come. And Manager, thank you so much for coming. I think that apart from what they do professionally, what they've also done over the years is literally pour their lives into people. And I admire them for one thing. One day I made a mistake of celebrating what they do in the media space, and it was just humbling to see people write and say, oh, saved my life, saved my loved one's life, and it was just humbling because this is more than ministry. This is the work of the Lord. So thank you, Carol. Thank you, Nanecha, for what you do. Let's celebrate them. And for all of us watching online, thank you for joining us today, and we trust that you have been blessed. Next week, Saturday, is the walk by the women. The women say they will do the walk, and then when they come back and they have the party, the men will come and help them to sign off. So we, the men of New Wine Temple, promise to support the women by coming for the reception. So the time is 5:45 a.m. So come and walk. And then Sundays, the all women's service. Come in your numbers for the service at 8:30 a.m. Next week's Wednesday is the sign of the grand finale of the learnings on their journey. And Comfort will be bringing us home with a wrap-up of this whole month. Please come in your numbers. And it's been the women have done a fantastic month this October. Let's put our hands together for the women. Well done. Just before I close, we're joined in the service today by one of the speakers for the Men's Month next month, my dear friend Professor Robert Hinson, Pro-Vice Chancellor of the Communications Technology University. He will be bringing us home in the marketing session next month in business. So, Prof, thanks for coming to join us to observe today. God bless you. Let's appreciate him. So the men of New Wine Temple will learn from our women next month and then put up a very, very special program for all of you. Let's rise up as we bring this to a close. Turn to your neighbor, tell them, surely goodness, mercy, favor, increase, health, wealth shall follow you and your family and your loved ones all the days of your lives. In Jesus' name, amen. God bless you and good night.
This October at the New Wine Temple, it's our Women in Leadership Month. Our PCH Hangouts will feature inspiring women sharing learnings on their journey as well as health tips as follows. Wednesday, 18th October, topic, Healthy Living, with 2 special talks on cerebral palsy awareness with Professor Nana Akyaa-Yao and breast cancer awareness with Dr. Ladzekpo. Wednesday, 25th September, topic, Learnings on My Journey, speaker, Mrs. Comfort Okran. The time is 6:30 p.m. to 8:30 p.m. every Wednesday at ICGC, the New Wine Temple, East Legon. Also be our guest every Sunday at 8:30 a.m. to 10:30 a.m. Let's worship, fellowship, dance, pray, and receive God's inspiring word with host Pastor Albert Ogren. Also note, there will be a women's special service on the 22nd of October 2023. Guest minister, Reverend Selina Klu Abini. We invite everyone, men, women, youth, and children to join us this October as we aspire to excel and be role models in all aspects of our lives. We are one big family in Christ.